Today is World Oral Health Day, and while we're all well aware that we need to be diligent to brush, floss responsibly, and to not neglect our gums, the steps to do so aren't as much work as you may think. But to not practice preventative maintenance could run you up a serious bill with your dentist.
You hear it from your dentist and your dental hygienists all the time. You know, they'll be telling you to floss and brush twice a day. The key there is also it keeps your dental costs down. You know, if you neglect your mouth, then you're going to end up with other problems, infections, pain, and then when you go in with symptoms to a dentist, more often than not, it's going to be very expensive dental treatment that could have been prevented.
So have the practices of taking care of your entire mouth, changed over the years?
Yeah, I mean, you know, the hygiene regimens only changed slightly over the past several years. You still want to brush and floss twice daily. It's good to use an anti-gingivitis mouthwash.
Use soft bristles to brush your teeth and everything. Usually much pressure is not the way to go. Gentle brushing and then just keeping up with your dentist really.
The overall hygiene is to help prevent other diseases around the body because the oral cavity is connected to the rest of your body.
The age ranges for orthodontic treatment have increased greatly, while the duration of treatment has vastly shortened.
We do recommend seeing all patients as young as 7 years old, forecast some issues that we could see that might come later on so that we can address those at the right time.
And even the most disciplined patients still face the paradox of choice. With an abundance of options and brands, how do we pick the right one?
Well, first and foremost, always be in touch with your dentist and dental hygienist because they're the ones that actually have the newest knowledge and information on products. But generally with products, the ones that I personally look for are ones that have like anti-tartar properties or anti-gingivitis properties.
There's also the mental component. Having a bright and beautiful smile also lends to confidence, positive mental attitude, and overall success.
As far as success in getting job interviews, success in networking and socializing in your community.
And Renaissance man Dr. Paul Sauget, as orthodontist, musician, entrepreneur, and pilot, is also working on bringing medical missions throughout the CNMI later this year, spreading healthy smiles throughout the region, and making sure they stay that way.
Certain products have a more acidic content to them, so those type of mouthwashes are to be avoided. There are other anti-gingivitis mouthwashes that have come onto the market that are safer for your mouth, and that would be something to consult with your dentist.